Yes. Okay. Yeah. Okay. Prynhawn da a croesi i'r cyfarfod Cyffredinol Blynyddol. Welcome to the Hywel Dda Annual General Meeting. My name is Judith Hardesty. I'm the Vice Chair of the Health Board. I'm very pleased to be here and very proud to be here. And I'm actually here in place of our Chair, Miss Maria Battle, who unfortunately can't be here this week. We have a number of presentations this afternoon, and we have some videos, and then there will be a section at the end where I will be referring to questions that we have received from the public. Before I hand over to the first presentation, I would like to say a huge thank you to all of the staff within Hywel Dda University Health Board. The last year has been incredibly challenging, as we have still been dealing with COVID, as well as recovering from the COVID position and delivering the best services we can to all our patients. I'd also like to thank the public in Hywel Dda for their support for the Health Board and also their understanding as we have moved to come back to the pre-COVID position. We recognise there are still challenges ahead, there are still things we need to do, and the things we are keen to move forward with. But this is an opportunity to just look back at the last year and remind people of everything that's been achieved, and also start to look forward to the year ahead. So first of all, I'm very pleased to welcome Delith Rainsford, who is the independent member of the board and is chair of our Charitable Funds Committee, and she will present the Hywel Dda Health Board Charities Report.
Diolch yn fawr, croeso I pawb. Thank you very much. I'm not going to say too much, and people that know me would be quite surprised about that, because I have a video, a presentation to highlight the work of the Hywel Dda charities for 2021 to 22. I have to say though, I never cease to be amazed by the generosity shown to our charity across all our local communities throughout the region. It wouldn't be possible for any of this work to carry on without your support, without our public and our staff support. And falle byddai'n gweud hynny bach yn Gymraeg, diolch yn fawr ofnadw I cymunedau, i'n staff ni, a'r pobl sy'n gwneud pethau anhygoel I helpu y charity. So mae fideo yma nawr, so bydda i'n mynd I eistedd lawr a gallwch chi enjoyo fe. Sim popcorn I gael dyn ni, ond mae'r rhaid I chi watcho hwn I weld beth I ni yn gallu neud gyda Hywel Dda. Thank you very, very much for this opportunity. This video is just wonderful, and it's just a snapshot of the work our Hywel Dda charities and our supporters especially give to us. Diolch yn fawr.
Oh, wow. So much going on and some of it really emotional. So thank you to everyone who's been involved in raising those funds. It's absolutely amazing. So I'm now going to move on to the next part of the agenda, which is presentation annual accounts. I'm not sure if it's accompanied to music or not, but I don't know. So I'm going to hand over to our Finance Director, Hugh Thomas.
Diolch, Cadeirydd. Thank you, Chair. Good afternoon. I'll present in Welsh, so I'll just wait for those of you in the room to put on your headsets, and for those online, the English language feed should come through if you switch the subtitles on your system at home, and the video which follows will be available on social media platforms. Plan da yn enw yw Hugh Thomas, cyfarwyddwr cyllid Bwrdd Iechyd. A I ddechrau, oedd hi'n rhagorol cael gweld y gwaith arbennig mae'r elusen wedi gwneud dros y flwyddyn diwetha, ac yn wir am y cefnogaeth mae'r elusen na wedi cael gan ein pobl ni yn y cartrefi ar draws yn sirodd, a felly diolch yn fawr iawn i chi am eich rhoddion hael i'r Bwrdd Iechyd. Mae wirioneddol yn gwneud gwahaniaeth mowr i'r gwasanaethau ni'n gallu darparu. Mae'n bleser cael sefyllwch blaen chi fan hyn i gyflwyno'r cyfrifon blynyddol ar ôl 2 flynedd o wneud hynny ar-lein. Sleid nesaf, diolch. Ar un nesaf, diolch yn fawr. Good. Roedd y llynau yn flwyddyn heriol arall i ni fel Bwrdd Iechyd, a mae'r cyfrifon yn sicr yn dangos hynny. Oedd yn gwariant ni'n bron yn 1.2 biliwn o bunnoedd y llynedd, gyda bron 1.1 biliwn o bunnoedd yn dod o Lywodraeth Cymru, a'r gweddill yn dod o nifer o ffynonellau eraill. Cawson ni 75.5 miliwn o bunnoedd yn ychwanegol y llynedd, yn adlewyrchu'r costau'r pandemig. O hwn, cafodd 32.2 miliwn o bunnoedd i ddefnyddio ar gyfer gwelyau ychwanegol, ehangu'r gweithlu, ac ehangu'r gwaith o glanhau'n ystad i leihau'r risg o heintiau'n lledaenu. Fe wario ni 19.1 miliwn o bunnoedd yn ychwanegol ar ddelio gyda'n rhestrau aros am ofal wedi drefnu. Dros y flwyddyn yn amlwg, roedd y broses o frechu rhag Covid yn rhaglen o waith hynod o lwyddiannus. Ac hefyd, fe roeddwn ni gefnogaeth ariannol i ddarparwyr gofal yn adlewyrchu i gwaith pwysig hwythau a'r heriau y gwyneb yn nhw dros y flwyddyn. Y cymhlethdod y flwyddyn, fe gadwon ni diffyg y Bwrdd Iechyd yn unol â'r cynlluniau ariannol gwreiddiol, sef 5 miliwn ar 20 o bunnoedd. Allai nôl sleid, sori, targed. Mae gyda ni 4 targed stydidol. Yn gyntaf, i weithio o fewn cynllun tymor canolig integredig wedi'i gymrydwyo gan y Bwrdd a Llywodraeth Cymru. Fel Bwrdd, oherwydd bod yn rhaglennu gwaith gweithredol a'n costau gweithredu yn creu diffyg ariannol, dydyn ni heb bod mewn sefyllfa i greu cynllun o'r fath. Yn ail, i sicrhau fod yn gwariant o fewn yn cyllid fel cyfanswm dros 2 mlynedd. I'r gorwariant lleihau dros y 2 mlynedd, rydyn ni dal yn gorwario bob blwyddyn. Fe lwyddon ni i gyrraedd yn targed i gadw'n gwariant cyfalaf o fewn y cyllid. Ac yn ola, fe nelon ni sicrhau bod yn cyfrifol yn rhoi golwg gwir a theg o'n sefyllfa fel Bwrdd Iechyd. Mae ganddon ni hefyd 3 targed gweinyddol. Y cyntaf, fel wedi sôn, dyn ni wedi gorwario dros y 2 mlynedd diwetha iddo wella o 2019 ac 20, a wedi aros yn sefydlog ar 5 miliwn ar 20 dros y 2 flynedd diwetha. A 2 targed pwysig arall yw'n bod ni'n talu'n credydwyr o fewn 10 diwrnod ar 20 o'r ddyled, ac i reoli yn llif arian misol. Fi'n falch gweud bod ni wedi llwyddo gyda'r 2 yma. Dwi'n mynd ymlaen i'r sleid nesaf. Mae'r sleid yma'n crynhoi yn incwm a'n gwariant dros y flwyddyn, gyda yn gwariant dros 200 o biliynau o bunnoedd yn cael ei wario mewn gwasanaethau cychwynnol, dros 250 o filiynau ar ddarparwyr eraill a thros 700 miliwn ar y nesbytau am gwasanaethau cymunedol. Ar un nesaf. I orffen, mae'r sleid yma yn crynhoi'n gwariant cyfalaf dros y flwyddyn. Mae gwariant cyfalaf yn hynod o bwysig i sicrhau isadeiledd y Bwrdd Iechyd ac i drawsnewid yn gwasanaethau. Cafodd 7.1 miliwn o bunnoedd i wario ar waith cydymffurfio a safonau tân, bron 11 o filiynau ar ddelweddu a 2.5 miliwn ar yr uned plant a merched yng Nghlygwili. Dim ond gwariant y flwyddyn diwetha yw hynny ar yr uned hynny. Dyn ni falch iawn o fod wedi derbyn 1.8 miliwn o bunnoedd ar gyfer gwaith o ddadgarboneiddio'r Bwrdd Iechyd, gyda gwelliannau ar draws nifer o leoliadau gan gynnwys fferm solar newydd ym Mharc Dewi Sant. A ni hefyd yn falch iawn am bod ni wedi derbyn bron i 19 o filiynau o bunnoedd i ddarparu uned llawdriniaeth dydd yn Llanelli. Uned fydd yn weithredol erbyn yr hydre ac yn rhan hanfodol yn gwaith o adfer rhestru aros ar ôl Covid. Wrth edrych nôl, ga i ddiolch i'n staff ar draws y Bwrdd Iechyd, yn partneriaid a'n gwirfoddolwyr am eu gwaith di-ddiwedd i cadw'n cleifion yn ddiogel mewn amgylchiadau heriol iawn. Ond mae'r blynyddoedd i ddod yn mynd i fod yn hynod o galed i'r Bwrdd Iechyd a'n gwasanaethau hefyd. Dyw'r rhagolwg ariannu ar draws y Deyrnas Gyfunol ddim yn adlewyrchu'r heriau gwirioneddol i ni'n gwynebu yn y gwasanaeth iechyd, a dyw'r gofynion na'r galw ar ein gwasanaethau ddim yn lleihau. Mae costau cyflenwi a darparu gwasanaethau yn cynyddu fwy wrth i chwyddiant a costau cyffredinol a gynyddu a'r galw am staff o asiantaethau yn aros yn uchel. Bydd creu gwelliannau a thrawsnewid gwasanaethau yn hanfodol i ni dros y blynyddoedd nesaf, ac mae'n amcanion cynllunio'r tîm gweithredu wedi llunio i sicrhau yn ymateb i'r galw hynny. Ac wrth gwrs, wneud yn siŵr yn bod ni yn rhoi anghenion yn cleifion, yn cymunedau a'n cydweithwyr yng nghanol yn gwaith, yn unol a'n gwerthoedd fel Bwrdd Iechyd. Diolch yn fawr. Thank you.
Sorry. Okay, thank you very much, Hugh. I was taken up with what you're saying in the pictures, so apologies for that. I'd now like to ask the Chief Executive, Steve Moore, to come and present the annual report.
Thank you, Vice Chair, and thank you to all the previous speakers. I've got a number of slides to go through, but I don't think they're really going to do justice to the amount of work that's gone on in the last year. But I stand here presenting for the third time in an AGM setting in the middle of a pandemic, and of course that is still very much going on. And it has been, I think, for all of us, our staff, our public, and our patients, another remarkable year in the NHS's history. Do you move on to the slides?
We had it set in.
If anyone knows. Thank you. Apologies, I think we're back on track. So yeah, I wanted to start in common with people who've already spoken on up here today by paying tribute to our amazing staff. I'm obviously being challenged today to keep on track with various issues. The challenge that we have faced and the changes to how we've had to deliver our care would not have been possible without the work that these amazing staff have done. We have once again, I think, as a health board, demonstrated our kindness, our persistence and our professionalism. And indeed, none of the achievements which are now set out in the annual general report would have been possible without the relentless energy and creativity of the people who work for us and with us. Board members will know, and this has been mentioned at many board meetings, but over the summer of 2020, we launched our 6 strategic objectives, all focused on working together to build a kind and healthy place in West Wales for people to live and work. And these strategic objectives continue to guide and direct the board's work. I feel a bit like Chris Whitty. The impact of the COVID pandemic, this has been for all of us, a really challenging time, and this awful virus has had, and indeed continues to have, a significant impact on our staff and our services. We've continued to change and adapt our services as the pandemic has evolved. With every new wave of the infection, however, we get a new set of fairly unique challenges. And as we start to move into whatever this new normal is that we now find ourselves in, trying to live with this virus, an important element for all of us is to ensure that our staff have time to rest and recover, and focusing on reducing the huge burden of waiting that we see across our whole service. Next slide. In 21-22, we continue to work in partnership with colleagues in Welsh Government and our local authorities, and indeed other agencies, to deliver a strong test, trace and protect strategy, which has been vital in how we keep our staff and community safe. And I think one of the things we've seen over the last 2 years is a real strengthening of those local partnerships. Next slide. We have continued to operate our regional response cell through the year with strong contact tracing in place and the infrastructure to respond as and when this virus has changed and developed. And in doing so, I think we can be confident that we've been able to reduce the potential spread of the infection. We've enabled local monitoring data on trends to inform our response at every stage, and ensured consistent messaging, which is about building confidence for our communities. Next slide. The COVID vaccination programme has already been mentioned, and I think has been one of the huge success stories for the NHS through this pandemic. It has also been the biggest mass vaccination campaign in the history of the NHS, and I'm very proud of the work that our vaccination teams, our volunteers and our staff have done across our centres and in primary care and community settings. Also, indebted to our local population, because in the end they had to turn up and have these vaccinations, and that has done much to protect both the NHS themselves and indeed their loved ones. Next slide, please. The pandemic has precipitated probably the fastest large-scale redesign in services that I know I've seen in my 30 years in working in the NHS, and I think that's nowhere more so than in primary care. We saw primary care rally to the cause when vaccines became available. Indeed, I think we were the first health board in Wales to offer the first and second doses through all of our practices, and I think very important for our rural community. And of course, we've seen primary care embrace and really take forward a shift to digital to allow people to continue to access services in the midst of the pandemic. And seeing the expansion in our community pharmacy and community optometry service, I think has also been a real testament to the energy that our primary care services have brought in the last year. Next slide, please. Indeed, in the same vein, our community teams, often I think the unsung heroes of our pandemic response, have similarly risen to the challenge. They've been supporting people with cancer in partnership with Macmillan Cancer Support. They've been training community pharmacists in mental health first aid, virtual wards, and remote monitoring of vulnerable people to ensure that we can keep in touch with people as our services came under strain, and expansion of community beds to support our hard-pressed hospitals at times of maximum pressure. Next slide. Another group who can be less seen but have played a vital part in our pandemic response are our fantastic therapists and diagnostic teams. Rapid establishment of a local long COVID service, apologies, I think was a real testament to the energy that they brought to this, and this was a new disease, a new set of symptoms that we hadn't seen previously. And despite the challenges, our diagnostic services continued throughout the pandemic and are now working on the recovery efforts that we are all making. Next slide. Of course, the epicenter of the pandemic response has been very much centred around our 4 acute hospitals, often very much at the front line of our battle with this virus. They've done so much. These bullet points on the slide don't really do justice to the amount of work that they've done, but to reconfigure quite small, quite often quite challenging sites in the way that they have, and to keep services running during that time, I think has been nothing short of miraculous. Next slide, please. And of course, despite our continued need during the year to focus on the pandemic, we have also been putting down the seeds of our recovery. It was a huge pleasure recently to see our special care baby unit and maternity unit open in Glangwili. That was a commitment we made back in 2015 and involved £25 million worth of investment from Welsh Government. We've seen new scanners come in to help with resilience in Withybush and Glangwili. And pictured here and mentioned in the Director of Finance report, I call them our demountables, but that really does not do justice to the facility that we've now been able to establish at Prince Philip. And this is going to really help us once it's commissioned at the end of the summer to accelerate planned care recovery for the hundreds of people who are waiting for our care. Of course, the submission of our programme business case as well in delivering the infrastructure we need for the future has also been developed in the background. And that will stand us in good stead for many years to come, and represents, I think, for West Wales a once-in-a-lifetime opportunity for that investment and that reconfiguration of our services. Also, there have been a range of other developments, too numerous to mention in detail, but we have set them out in the main report for those who want to see them. I did want to call out one particular thing on this slide, and that was that they are dedicated research facilities. It was great to be at the opening of the research facility in Glangwili. It was remarkable to see the work that we are doing in research in this area of Wales. We're leading Wales in many cases, and actually in some we're leading the UK. We are hoping next that we'll open a facility similar to this in Bronglais, and there is work going on to try and do so. And I think what that tells us that we may live in a beautiful part of West Wales, but that doesn't mean that we shouldn't get access to the kind of research, our patients, our staff, the access to the kind of research that you may only see in big cities. So I'm looking forward to seeing how that develops in time. Excellent, thank you. I also wanted to call out the remarkable work of our GP out of hours service. They've seen some of the biggest challenges during the pandemic, and of course the work of our cancer teams, our eye care teams and mental health, from introducing bowel cancer fit testing to 6 day working in diagnostics and new cataract services in community settings. The rollout, as we heard in our public board meeting today, of the mental health 111 Press 2 service, again a first for Wales. All of these staff have risen to the challenge in this period. Excellent. So on patient safety, quality and experience, we know as a board that our aim is to ensure that we have the safest and best care for our communities and our patients. Often a challenge given our rurality, dispersed services and some of our facilities, but we are working really hard to improve and sustain the quality and safety of what we do. I would particularly like to call out the work of our family liaison officers, a sort of invention through the pandemic in an effort to both keep patients in contact with their loved ones at a time when staff were really busy. They did so much to keep people connected, and I'm really delighted that we have found a way to keep that as a permanent feature of our system going forward. On the partnership front, engagement, I think it is worth reflecting, has been quite challenging during the pandemic, helped somewhat by technology, but not really a replacement for being together. But central, I think, to how we work as a health board. We have many partnerships, and I think, as I mentioned earlier, these have really strengthened during the pandemic. I would particularly call out our partnership working with local authorities, our universities, the links we've now made into the care home system much more sustainably. For example, we have worked with our local authority partners through all of the work on test and trace, We've got a strong foundation now to move forward as we come out of the pandemic on some of the challenges we have in our community care system. The work we've done with the university, I've already mentioned the research facilities that we've got set up, but of course we also have the fantastic development of the School of Nursing in Aberystwyth, which is going to make a significant difference for the Mid Wales community. And of course, alongside all of this and going on right now, the land identification process, where we are ensuring that we have very strong public voice and engagement in that appraisal process. Thank you. So on workforce, our staff, as this says on the slide, have gone above and beyond every day in the face of unparalleled pressures and challenges. A key priority for us as a board is to continue to find new ways to support them, both now and in the future, because they are at the core of what we are able to deliver for our patients. Their perseverance, their creativity, their kindness has made me probably more proud than ever to be a small part of this fantastic organisation. And I know as a board, we will want to do everything we can to support them. We've got things like our relationship managers now out in the service, embedded with our teams, and they're helping to drive our supportive culture and personal developments for staff. And we launched our Wellbeing Champions, which was picked up in the charities video across the health board to help in that regard. We have introduced a number of things, you're starting to read my mind now, a number of things which have been very new to the health board. We've got a number of examples on the slide there. Another few examples I would call out would be our Wellbeing at Work webinars, the bespoke rest and recovery sessions, and I'm really proud of the Recovery in Nature Ecotherapy workshops, again supported by our charities work, giving staff who've been through the most difficult time an opportunity to retreat, to reflect and to restore themselves. And as I've already said, our workforce have achieved remarkable things over the last 2.5 years. We are breaking new ground in developing a detailed long-term workforce plan that others now in Wales are looking to and wish to adopt. And we are working very closely with our BAME advisory group, ENVIS, staff partnerships and other partnerships to ensure that as an organisation we are as connected as we possibly can be. And on the well-beings of being of future generations, I think we are also breaking new ground in areas like decarbonisation, developing our green spaces and looking to design our facilities biophilically. And of course, we have our wonderful apprenticeship academy, and I believe that is going from strength to strength. And we heard today at our public board meeting the establishment of the first joint apprentices between us and local authorities in Wales in this year. We are also ambitious to be a fully and seamlessly bilingual service through things like our single point of contact work and embracing not just the language standards, but the wider cultural issues that are so pertinent to our part of Wales. And finally, I wanted to mention our community development outreach team, the work they're doing with our public service boards to bring our social model for health together and rise to our climate emergency. I have to say, when I went through these slides, there's been so much that I could have talked about, and this really only scratches the surface in a year when we were still very much in the midst of the pandemic. I would encourage members of the public to have a look at our detail in the annual report. We're doing the things that we are doing in spite of, and sometimes because of, the pandemic. So I'd end just by reflecting that as an organisation, I think we've been through another challenging and remarkable year. We are still on our mission. Together, we can build a kind and healthy Mid and West Wales. And I'm going to just end now with a short video, which will hopefully summarise some of those things.
Together, we are building a kind and healthy Mid and West Wales.
It's been another extraordinary year with enormous challenges to the NHS responding to COVID-19 and providing care. Personal sacrifices have been made to keep ourselves, our loved ones and our communities safe. We are now on our journey to recover, bringing new learning to the challenges ahead of us and with hope for the future.
Together, we are putting people at the heart of everything that we do.
In hospitals, high street primary care, in communities and in your own homes, our staff are here for you. For those with physical, mental health or learning disability needs, from the very young to older people and everyone in between, you matter to us. We are delivering more planned surgery by building our capacity and working in different ways. Contacting and supporting those who have faced waits longer than any of us would wish by rolling out a waiting list service. Providing a one-stop diagnostic clinic to diagnose people who may have cancer. Building care around the rights of children and what matters most to them. Trialling new ways to care for frail people needing urgent care and trying to improve your overall experience with us.
We're working together to be the best that we can be.
The relationships we have matter. Between patients, families and carers, paid and unpaid, between staff and teams, and between different organisations involved in health and care. This is how we build stronger, healthier communities. Amongst those we are working with, community connectors or social prescribers to help connect people with activities for well-being and improved health. Our minority ethnic communities through the new Community Development Outreach Team, CDOT. Ambulance service colleagues on a First in Wales pilot to receive patients directly and more quickly into one of our same-day emergency care units. And our staff are incredible. They have won dozens of team and individual awards for the improvements they have made to people's health and care outcomes or experiences. It's our job to look after them. We are providing new training opportunities in clinical and non-clinical services, giving staff new opportunities and attracting new staff. Enhancing our support to those affected by sickness or burnout, including our new eco-retreats. Supporting teams and our organisation to be a place where everyone has more good days at work.
Together we are striving to deliver and develop excellent services.
Through the year, we have welcomed some exciting new developments. A new state-of-the-art MRI scanner at Withybush Hospital. 2 new operating theatres at Prince Philip Hospital. A new clinical research centre and multi-million-pound maternity ward at Glangwili Hospital. And our health charities team launched a fundraising appeal for a purpose-built chemotherapy day unit at Bronglais Hospital. We strive for continuous improvement. Our data scientists work with our operational teams to provide real-time information and forecasting that can help us improve. Some of our community pharmacists can provide antibiotics to treat urinary tract infections for non-pregnant women aged 16 to 64 without seeing a GP. We've seen a massive expansion in what we can offer through digital services, from online platforms that connect you to a clinician without need to travel, to home monitoring devices that can keep a check on your vital statistics to ensure you are well.
Together we want the best health and well-being for our communities.
We are seeking more than £1 billion of investment in health in our area, including in current hospitals, new community hubs and for a new planned and urgent care hospital in the south. Our vision is to move from a service that treats illness to one that also keeps people well and provides as much care as possible closer to home. We're working with our staff, partners and communities and ensuring their voice and input is part of what we do. There's a breadth of work to improve population health, including a pilot project to equip Dyfed-Powys police officers with a spray that can help save the lives of people who take an overdose. Providing a dedicated long COVID service to equip people with the knowledge and skills to manage their ongoing rehabilitation with support from different professionals. Supporting patients to live healthy lifestyles through schemes such as the Health Coach.
Together, we're providing safe, sustainable, accessible and kind care.
These are the principles by which we deliver and design our services and support for our people. We are providing a new nurse service with Dementia UK, providing guidance and practical solutions for people living with dementia and their carers. Supporting pregnant people and those with young babies with their mental health through emotional well-being, bonding and attachment and other practical and safety skills. Helping more children through play, such as providing bilingual communication boards using symbols to support inclusivity in community play areas. Reducing the risk of hospital admission by providing out-of-hospital support, such as the Kutch service, which provides people with low-level domiciliary care, including meal preparation and medication prompts, and building their skills for self-care.
Together, we are making sustainable use of resources.
We want to make the best use of all the resources we have and reduce our impact on the environment, protecting and nurturing our communities in their widest sense. Whilst we face high demand and support services which are fragile, we are working to ensure good value and avoid deterioration of our financial position. We are working on providing more social value through our buying and procurement processes. Our aim is to use the skills, capabilities, supply chain and recruitment potential of our suppliers to positively impact our communities. We're on a path to decarbonisation, installing solar panels and carports at some of our hospital sites and developing a solar farm at our headquarters.
It's perhaps only by looking back that we can fully appreciate how far we've come. The adversity we faced may not be over yet, but we have learnt, we've grown and we've come together. And actually it's by coming together that we will build a healthier Mid and West Wales. And you can all play your part.
Oh, thank you. That was brilliant. I don't know who was responsible for putting that together. Alwena, your finger's been pointed at you. It's absolutely brilliant video. Thank you to you and your team who've done all that. And if it's not you, whoever it is, pass it on. That was great. Thank you. Still, I have to stop watching these. They always bring a tear to my eye and then I have to get up and speak sensibly. So thank you everybody for the presentations and I hope everyone who's watching this has enjoyed it. Now, we did ask members of the public if they wanted to submit questions as part of the AGM and I'm going to see how this works. We haven't rehearsed, so bear with us if there's a few pauses. The questions and a full answer will be on the Health Board's website. Some of the questions that have been submitted are quite lengthy, so I'm not going to read all of them out. I'm just going to read out a sort of a main point from each one. So I want to apologise to those who submitted them, but it's not that we've missed the whole of the question, and they will, as I say, appear in full on the website along with the answers, and the executive colleagues I'm going to ask to answer them will give a summary answer, and again that will be able to be read in full on the website. So the first question has been received from Diane Taylor and her question is as to why there are no hip and knee operations taking place at Withybush, and I'm going to ask Andrew Carruthers, our Director of Operations, to come forward and answer that.
Thank you, Chair. And first of all, I'd like to apologise to Mrs. Taylor's husband for the delays to his treatment that he's experiencing and any distress that is causing him and his family. And I'd like to make sure we extend that apology to anybody currently waiting on a waiting list within Haldar. And want to assure you that we are working as hard as we can as an organisation, and my teams are working as hard as they can to improve that position as quickly as possible. It's well reported that COVID has had a significant impact on waiting times and waiting lists, not just in Haldar but across the NHS in Wales and the UK. And unfortunately, whilst the higher levels of COVID infections seen in earlier waves of the pandemic have now passed, it's still having a significant impact on our ability to re-establish the level of service we had and capacity we had prior to the pandemic in March 2020. It's been a key principle of our plan and our recovery plan that we sought to ensure we reduced the number of people waiting and the time they were waiting for as quickly as we possibly could. And in doing so, it was important that we reviewed the differences in physical capacity and staffing resource and match those together best we could to maximise the amount of activity and procedures and interventions that we could undertake. In doing that, we've had to look at how we configure some of those services and the delivery of those services over the course of this year as we try and re-establish ourselves after the pandemic. And that's led to a scenario whereby we've reinstated, or we are carrying out inpatient and day case orthopaedics in Blynyddol Hospital and Prince Philip Hospital, but focusing on day case procedures in Withybush. We looked at a lot of information and data when we were coming to that decision, and the impact of doing something different is a minimum of 500 patients to 750 patients less treated over the course of this year in orthopaedics alone. That would effectively and almost double our number of orthopaedic patients waiting for surgery at the end of the year. So we felt the plan we had best targeted the need and waiting times across the population. There is equal access to those inpatient lists in Prince Philip for both Pembrokeshire and Carmarthenshire orthopaedic surgeons. And we're treating people in order of clinical priority and the length of time they've waited. So there should be no disadvantage to anybody in terms of the time they wait from where we're now carrying out the surgery. You know, we will continue to review that plan through the course of this year at every moment possible to see how far we can extend that and accelerate the delivery and recovery of the waiting times position.
Okay, thank you. I now have got a series of questions that have come in from Wendy Ellis, and I think there's 2 or 3 which I'm going to ask the medical director to answer, and then there's also one which I will address for the Director of Workforce and OD. So the first question, and this relates to, they all relate mainly to Withybush Hospital. So the first question is, why is the board so intent on downgrading Withybush Hospital and leaving Pembrokeshire without a major hospital?
Thank you. I'll take the first question. So Phil Claw, Medical Director, Deputy Chief Executive. Look, our aim is for Withybush to provide high quality urgent emergency and planned care until the new hospital is opened. And in fact, we want to make really best use of the facilities at Withybush during the time that we prepare for the new hospital, including the access to the emergent and urgency care centre, the wards, the outpatients, diagnostics, and the theatres. Even after the new hospital that we're proposing is built, it's planned for Withybush, the repurposed Withybush, to play a really key role in our system, in providing healthcare and supporting health and well-being for the population of Pembrokeshire. In fact, the activity that will be taking place in Withybush and within Pembrokeshire should be vastly more than in the new hospital. So I'm going to hand you to the next question.
Yes, right. And the next question is, why is the health board closing wards, in particular the children's ward, and how are we going to help parents with travel costs?
Thank you. So the inpatient children's ward actually closed in 2014 as a result of the paediatric review and public consultation that was undertaken at that time, and it was replaced by the paediatric ambulatory care unit that was based on Puffin. In response to the in the interim period, I should say, Ward 9 has been used for a number of different clinical purposes, but in response to the pandemic and our recovery, we have this and the need for a dedicated ring-fence selective surgery ward in Withybush. We have now, Ward 9 is now that dedicated surgical ward. In March 2020, as part of the COVID-19 response, the Paediatric Ambulatory Care Unit based on Puffin Ward was relocated to Glangwili Hospital, and we changed the pathway for paediatric emergencies in Pembrokeshire. And we had to do this to enable us to safely manage emergency patient flows at Withybush whilst adhering to all the infection prevention control guidelines that have come into force or into existence as a result of the COVID pandemic. At that time, this was planned to be, and still is at the moment, a temporary change that had to be extended, and we've taken steps in the intervening period, partly due to the forecast risk of RSV flow demand to strengthen that pathway. And we're currently in the process as a health board of undertaking a detailed review of paediatric services and that decision, and an update was provided to the board on that in more detail in May. In response to the specific part of the question that covers travel costs and assisting parents, the children's ward itself is able to accommodate one parent at the bedside, and we do provide accommodation for families at a designated local guest house and hotel in the local area. And we do and will facilitate health board approved taxis where applicable, and would facilitate travel costs for all where practically possible. So far to date, there have been no requests to facilitate travel costs since the change in pathway to Glangwili.
Okay, thank you. The next question is asking how many patients in total are being treated in other hospitals, this is other hospitals than Withybush, who would have previously been treated in Withybush. What's the breakdown of illness and treatments now being given elsewhere? Phil.
So thank you very much for this question. It's quite a complex question and open to a bit of interpretation. So what we'd like to do with this question is treat it as a freedom of information request to enable us to go back and seek clarification with the person who's asked the question and answer it more clearly. So thank you.
It's working okay so far. Right, the next question is I'm going to ask Lisa to come up, and it's what is the health board doing to attract medical staff to the area, and what training plans are in place?
Thank you. And there are two strands to answer this question. So one is around what are we doing to attract, but also what are we doing to retain, and both of those things will also support attraction. So some of the key things that we are doing is we're looking at our medical induction programme so that we make sure we have a very good welcome for anyone that joins our organisation. We have an aspiring medical leaders programme to support individuals who want to progress in their careers. We have a consultant development programme for everyone who moves into their first consultant roles. We have an SAS doctor steering group so that the voice of our SAS doctors are heard and we can make changes to the workplace linked in with what their requirements are. We also have a CSER lead within our organisation, which is quite unique. We support CPD, so continuous professional development. And we also, from a recruitment point of view, have a number of programmes of work in place. One is around overseas recruitment. We advertise on London Undergrounds across the whole of the UK, nationally, to try to attract a medical workforce. And we're also introducing new roles. So physicians associates, roles that will help our medical workforce in the workplace so that they can be the best that they can be as others doing some of the work that other practitioners can undertake.
Thank you. I think the next set of questions are for you, Phil, Medical Director. So there's two more that have come from our previous questioner. The first one is clarification is sought on the development of the new community health hubs and why the Health Board spent £646,000 on the Fishguard Health Centre instead of Withybush, and keeping Goodick Medical Centre open?
So thank you for this question. And in fact, North Pembrokeshire was identified as an area of real importance in our transforming clinical services conversations engagement. And the Health Board did spend 646,000 in the development of the Fishguard Health Centre, and that represents phase one of our plans, and it addressed some of the challenges we had around sustainability of general practice services in that area, and also community services. It enabled a number of things, amalgamation of Fishguard and Goodick GP practices, also amalgamation of district nursing services to provide greater sustainability there, and access to other services locally, such as anticoagulant clinics, and improved accommodation for a whole range of community services that can be provided for the local population in that area. At the time of the business case, there were some specific risks around Goodick surgery, which urgently needed addressing, and this development has addressed those risks that we had, including termination of the property lease, for example, and real challenges around GP staffing in the Goodick practice. So there is a phase two development planned as part of our programme business case, and that would link in both our local authority and third sector colleagues, and it will further allow us to move towards providing health and care closer to people's homes in their communities. Okay.
Thank you. So we now, no, there's one more question, sorry. And this is, has the Health Board considered how the new 20-mile-an-hour speed limits being introduced will impact the golden hour? I think these are going to be discussed by for local authorities to decide where they should be implemented.
So our Health Board proposals for the new hospital were mapped to ensure that we do provide an emergency response that's as close as possible within an hour. In fact, for the vast majority of the population, the zone that the new hospital is proposed to be built in does provide that access within an hour. And Welsh Ambulance Services have been involved in all of our in all of the design process for transforming clinical services process, and will be involved in the future design process. The emergency response isn't simply defined in timelines by the golden hour. The emergency response starts when the call happens to the Welsh ambulance, if someone is phoning the ambulance, and then continues with the arrival of the paramedic. And the paramedics are highly trained. They can provide all sorts of support and intervention, immediate care at the scene to make sure that the journey time can happen to allow the person to get to the hospital where the best care can be provided. And sometimes that's within our hospitals, most of the time it is, but sometimes it's even outside our boundaries. And some emergencies do get do require clinicians to be transported to the scene, which we get through our emergency medical retrieval and transfer services. That's EMERTS Cymru, and we're continuing to see advances in that. We have seen the introduction of the 24-hour Welsh Ambulance Services, Welsh Air Ambulance, since July 2020. So there have been some significant advances, but do recognise how concerning this is for the population, ambulance response times, and that's why we're putting a huge amount of effort into considering that and how we do provide support rapidly to people in communities. The other thing we know is that ambulance response times are also defined by how quick the turnaround is at our hospitals. And we believe that by providing these improvements to our staffing challenges and safety through the new hospital system, that will allow people to get much quicker access to specialists when they arrive at the hospital, and will allow ambulances to be released much more quickly into the community, and that will provide a much quicker response time.
Thank you. We now have a series of questions from Natalie Mason, and I'll be calling on Phil again for two of those, so I'll read the first two out. The first is, why is the Health Board not listening to the people of Pembrokeshire who say they need Withybush Hospital? And then the second part of that question is, will the Health Board be able to guarantee that there will be no deaths or serious illness caused by the additional travelling time to the new hospital?
Thank you. So in answer to the first question about Withybush, I mean, I said earlier, and I sort of repeat it in a way, that Withybush, even after the new hospital is built, will play a really key role in the provision of healthcare and promoting health and well-being for the local population as a local community facility. And it will also be linked very closely with all the other community facilities in Pembrokeshire, and the rest of community and primary care services. So Withybush really will play that key role through our the transforming clinical services process that we went through engagement and consultation, which was clinically led. It was strongly recognised that it's just not possible and sustainable to provide A&E services in both Withybush and Glangwili in the medium term even. And in fact, even now, services are incredibly stretched in Withybush and Glangwili, with extremely small numbers of consultant staff spread across those sites. And through that process, we recognised that we could provide a much higher quality service that within that zone, in a new build where we combine the resources of Glangwili and Withybush A&Es. But Withybush will provide a key role in the future, even after the new hospital is built. In the second question, look, our aim is to improve health and reduce harm, and we work internally as a health board, but also with our partners in the delivery of healthcare services to minimise any risks of harm to the population associated with our current services, as well as with any future service change.
Thank you. And we have a final question from Natalie Mason, and that is, can we have a vote of no confidence in Haldar?
Thank you. Thanks for the question. I thought I would pick this one up. There will be a fuller explanation, I think, forwarded to the question and on our websites. But I guess the simple answer at the moment is there is no formal framework or process to support that happening. However, the board does have a very clear duty to take account of representations and the views of individuals and communities. So I guess in essence, regardless of the legal framework, I know this board, should such an eventuality occur, would want to ensure that those views are taken into account as part of its decision making and deliberations. I would, however, hope that we could continue to work with our communities so that we can avoid such an occurrence happening.
Thank you. Right, and I have a series of questions from Kevin Dyer, and a number of those are for our Director of Workforce and OD. So if it's okay, I'll read the questions, you've got them, so you can then answer them. So the first question is asking if we can split the 900 vacancies as advised by the Health Board between the main hospitals. We are then asked about, given the number of vacancies, why are so few jobs advertised? And we have a question asking, does the board have to make requirements for Welsh speakers in their adverts? And has a survey been carried out to establish how many of the Withybush or Glangwili staff would transfer to the new hospital? So if you could cover those, and I should add there's obviously quite a lot of detailed figures in this answer, and they will be available on the website. Lisa.
Thank you. The vacancy figures for the 4 hospital sites are actually 816 whole-time equivalents. So we do have vacancies that aren't for our hospital sites. Just to give a very brief breakdown of those, Broncos Hospital has 86.92 whole-time equivalent, Prince Philip 56.85, Withybush 95.08, and Glangwili 169.21. In the full response that we give, we will break that down by staff group as well, so that you can see the types of workforce. The second question, given the number, why are there so few jobs? Our adverts don't contain a whole-time equivalent. So one vacancy could actually be 20 jobs. So that could be one of the reasons that people aren't seeing the volume of vacancies linked with the jobs. And also, we've recently introduced centralised recruitment. So we will do one advert for the whole of Withybush Hospital. So again, there could be some large numbers beneath one vacancy. The third question, do we have a requirement for Welsh speakers in adverts? We are bound by the Welsh language standards, and we have to provide care to our patients in their language of choice. And therefore, we make an assessment using our bilingual skills strategy around the language that we need for any new recruits. We will look at the workforce that we have in an available area and make a decision on whether the job is Welsh essential or Welsh desirable. For many of our roles, we will advertise just in Wales, and therefore in our Welsh jobs, we will be looking for individuals who are willing to learn the language. So we don't necessarily say everybody has to be a fluent Welsh speaker. This is about being able to converse basic conversations with our patients in their time of need. Other posts where we advertise nationally, we don't put that in an advert. But again, when we employ people, we try to encourage individuals to learn a few basic phrases. The fourth question, have we carried out a survey around staff who will transfer? As part of the workforce appraisal group, we have undertaken a survey. The response rate was extremely low. However, it did give us an indication from those individuals who were prepared to travel. The other thing that we consider in all of this is we're talking 8 years away. So actually some people who are leaving our primary schools today will be our workforce for the future. And therefore, in terms of engagement with our staff, we work very closely with our trade union reps, and will have begun a series of engagement with our workforce across the whole of our organisation about their future requirements, desires, what will make the new hospital an attractive place to work if that's where they want to work, and what can we do to support individuals who may not be able to travel to a new hospital but will want to.
Thank you. Don't go away. I have another one coming up. No, it's all right. I think I go to Phil next for this one, and it's why does the proposed new hospital have 90 less beds than the existing combined total of Withybush and Glangwili?
Thank you. So thank you very much. So the new urgent and planned care hospital will be designed to have separation of planned and emergency care. So it will mean that the planned care beds will be ring fenced, and therefore we'll be able to get more activity through them and get more operations through them. Also, the changes to the function of Glangwili and Withybush where they will operate as local community hospitals, means that they will have nurse and therapy led beds. So they will be also part of that system. So it is, so whilst the new hospital has been modelled at requiring 594 beds, there are also just over 100 beds at the moment planned in Withybush and Glangwili. So in total, and that the actual total beds between all three would be 624 beds. In fact, the modelling that we've done has not only taken into account the efficiencies and improvements that we would get in the new system, it's also taken into account the increasing the ageing demographic that we have in our population. So in one sense, there is an increased need for beds because the increasing demographic of the population, but on the other side, there is a slightly reducing need for beds just because of the much more improved way of the operating of our system. And the modelling therefore comes out to this number of beds.
Right, now there's two questions here which really encompass the sort of planning around the new hospital and also running the existing services until it's ready. So the question is, what is the projected staff increase to allow Withybush and Blynyddol to operate up to transfer and also staff the new hospital to allow for its work up? So I don't know whether you're to jointly answer that question. Or Lisa, you come up. Thank you.
I'll start and Phil may want to add. So the first part of that question is, if the question is asking how many people do we need in Blynyddol and Withybush up to the point of a new hospital opening, it will be to the level of the vacancies I've just mentioned. So that is the number of staff that we require. If it's asking what do we need because we may need to dual run, then that is part of the detailed workforce planning that we're undertaking now. So we know part of what we need in that future, but the dual running part will need to be further worked up. And I think the other important thing to notify everyone of is our future strategy isn't just our hospital. So part of that workforce planning is what are the staff we will need in our communities as well. And that is also part of that 10-year workforce plan.
Right. Thank you. I think that final point is really important, and we'll make sure that that is pulled out in the answer about this is not just only about the hospital services. So we have no, actually there's, I think, two more questions for our medical director, so I will read both of them out. The first one is, given the extra miles that ambulances will need to travel out of Pembrokeshire and Ceredigion, what increase is proposed for emergency vehicles? And Withybush and Blynyddol are currently near large police stations. How will this affect policing when the new hospital, wherever it is located, will be less close?
Thank you. So we have a whole wide range of really important stakeholders, including our ambulance services, our police, local authorities, and other third sector organisations, a whole wide range of important stakeholders. For answering the police question first, we'll be working closely with the police to understand what provision the police might need in the new hospital facility as part of the business case development process. In terms of Welsh Ambulance Services, we work, we're part of EAST, which is the Emergency Ambulance Services Committee, and also Welsh Ambulance Services. We work very closely with WAST, and we will do in the implementation of our whole strategy and in the development of every health pathway. So we will work with them to consider whether we need any additional resource in our area, and we're in constant contact with them about additional resource. I think it would be too early to say at this stage as to exactly what resource would be required in our area, but as we work in more detail, as we get to hopefully to outline business case stage, we will work really closely with them to understand that need and requirement.
And the final question from this questioner is, given the collapse of NHS dentists in Haldar area, what happens to unspent money? Is this ring fenced and returned to Welsh Government, or does it go into Haldar funds? I'll ask the participant to answer.
Thank you for the question. The Health Board budget for primary care dental services is actually fully committed. We are working through a period of recovery and reset, and dental practices in line with Welsh Government guidance are needing to prioritise those most urgent patients first. So that does mean that routine access for patients requiring routine access is more challenging. There are a series of measures in place, however, that will monitor performance, and that could mean at the end of any year that there would be some recovery of finances. And we are always committed to actually reinvesting that funding into our primary care dental services. I think what the Health Board has actively done also over this period is to reinvest some of that resource in terms of improving our urgent access to dental services at that point in time. And we currently continue to have those plans to try to improve access for patients requiring dental services as far as possible, but recognise the challenges that are created by this point in time.
Very much. Okay, now we move on to a number of questions from Judith Thomas. The first question is, what is the Health Board doing to ensure safe staffing across all clinical teams, especially those without coverage within section 25B of the Wales Staffing Levels Act? And I'm going to ask our Director of Nursing Quality.
Thank you. There will be a fuller response on the that is submitted, but in the meantime, just to summarise that we do operate a formal process of review throughout the year to ensure that the staffing levels that we operate are sensitive to meeting the needs of patients in our care. Whilst initially we started off with that process being focused as required under the Act in 25B medical and surgical wards, we have evolved the process to make sure that it includes our 25A, i.e. all of our other areas as well. There are three key points that I just want to bring, that I want to raise. One is about the fact that staffing levels are reviewed on a shift by shift basis, and that is based upon the acuity needs of the patients in our care, and it's based very much on professional judgment as well as any formal tools that we're able to use. We do deploy temporary staff wherever and whenever available or necessary. We've also taken some considerable learning from our experience and of the approach that we adopted in our field hospitals, and from there we've evolved into developing new roles that can be introduced across a variety of areas, again to meet the needs of individual patients. And then thirdly, it's about supporting our staff to continue in their professional development and competencies to meet the variety and complexity of the needs of the patients in our care. So we are looking at this on a shift by shift, day-to-day basis, 365 days a year. Hope that's helpful.
Thank you very much. So the next question is asking, what contingencies are there to reprioritise services should another COVID-19 wave be experienced? And what plans are there around the vaccination programme for the autumn? And I think Jill.
Thank you. So should there be a further wave in terms of COVID-19, we would actually reinstate our COVID-19 plan, and we would prioritise the services in a proportionate way, depending on the levels of infection that we were experiencing at any one time. In terms of the vaccination programme, we have previously delivered a robust programme for our vaccination for our boosters through largely a primary care response, supported by our mass vaccination centres. And I can confirm that plans are underway in line with JCVI guidance and Welsh Government guidance to plan now for that autumn booster. So we do have interest and commitment from our practices at this point in delivering that robust plan, and we will support that with our mass vaccination centres for health and social care staff primarily. So we'll be confirming those plans in due course. Thank you.
Thank you. I now have two questions which I think Lisa will be answering. The first one is, how is staff welfare and well-being being supported as they continue to see exceptional demand on services while supporting the recovery plan? And a second question is, what support will be given to staff experiencing long COVID symptoms?
Thank you. Staff welfare and staff wellbeing. You will have heard some of this in the presentation that you had earlier when the Chief Executive was talking. But we have a staff psychological wellbeing service that is led by a consultant clinical psychologist. We have confidential support and advice that's given to our staff should they require it. We have a culture of wellbeing and resilience that is being offered through our OD, organisational development team. We have a rest and recovery programme in place to support staff. We have high quality resources. One of the things that our head of staff wellbeing felt is that there is lots of resources out there for individuals for psychological wellbeing. What she has done is cohorted all of that information and will support people to access the right information for their given circumstances. People have access to one-to-one psychological support in each of our counties. We have a 24/7 telephone counselling service that is available to anyone at any point in time to provide that immediate support. We have access to evidence-based programmes and courses that are provided to our staff and to our managers. You heard about ecotherapy programme, extremely successful. There's another programme being launched this week for our staff. We have a staff benefits app that not only provides staff benefits to staff, but also signposts again for individuals who are under psychological or financial pressure at the moment. We have wellbeing roadshows where the staff psychological wellbeing team go around the organisation to talk to staff. We have a speaking confidence platform, so if individuals want to raise a concern, they can have a direct access to a member of the workforce and OD team who will work with that individual to access the right support that they need. We have a financial wellbeing programme. Some of that was in our public board meeting earlier today. We also have a programme in place where we're looking to enhance our staff rest areas so that during the day they will be able to take some time out of their busy environment just to take a few minutes to rest and recover themselves. And again, it was on the presentation a few minutes ago, we have our lifelong learning fund. So we're supporting individuals to just undertake a hobby that is not work related. And you will have seen a picture of a lady who had made a necklace, and it was just something that really got her out of the workspace and allowed her to have some time just to be herself. So that's a summary of some of the things that we have in place for our staff. In terms of staff experiencing long-term COVID, when COVID first hit, changes were made to terms and conditions of employment. So staff experienced enhanced sick pay arrangements to support them through what was the unknown at that point in time. And as long COVID developed, knowing that the patterns of people feeling unwell changed, it supported their recovery without them having to worry about coming back to work and the financial implications of that. We also have access to the long COVID support, again, that's been heard about for the public, and that can be accessed through our staff psychology service. So when individuals are seen in occupational health or staff psychological wellbeing service, they will be signposted to that service. We have a supportive toolkit that has been put in place for our managers and our staff so that individuals with long COVID can talk about the condition that they're experiencing, when they're feeling fatigued in particular, and we have flexible working arrangements to support that individual to be in work when they can be and not to be when they're not well enough. We also have phased return plans that then align into that. And a member of the workforce team regularly links in with managers and or staff that we are aware who have long COVID to just check in on them and see how they are and whether we need to make any adaptations to their work plan.
Thank you. I now have a question from Karen Roden, and her question is, why is the Health Board looking to move medical services, particularly A&E, more than an hour away from some Pembrokeshire residents? I think some of this has been touched on. If there's anything else you'd like to add.
Yeah, so thank you. Thank you, Karen, for the question. It's quite similar to the previous question where there was concern about the golden hour. However, it gives a personal slant on this. And I suppose I talked previously about my point about the golden hour, points about the way we're working with Welsh Ambulance, the way paramedics work, and also the emergency medical retrieval and transport service. But and also the previous question was concerned about road infrastructure and 20-mile-an-hour speed bumps, and we'll work with local authorities as part of our planning on is there another key stakeholder on the new hospital system. But I suppose the question is why are we proposing the new hospital system and the new build, and why would we move medical services? And I think the basic issue is that every year that goes by, it becomes harder and harder to provide safe, sustainable, accessible and kind care at our hospitals, particularly at Glangwili and Withybush, because of the sustainability challenges, because of the way, not just the facilities, but just because they're spread, the workforce is so spread that they're unable to work in ways that other doctors would work in all other places across the UK, and it's therefore really difficult to recruit into those services. And so therefore we want to move to a place from where we're just mitigating the risks to aspiring for excellence across all of our services. I know we do provide excellence in many of our services, but we want to aspire to excellence across all of them, and it will allow our doctors to develop more specialist expertise, to bring back services back into Hywel Dda. It will allow them to have peer support where they're working together. It will allow them to provide more educational experience, so we have more doctors coming to work here, more nurses and therapists, and they will be able to engage in research and innovation activity in ways that it's more difficult to now. So by being able to provide much higher quality of care, albeit a little bit further away, it will mean that when you do get to the hospital, you'll be much more rapidly seen, and we'll be able to be aspiring for excellence in those services when you travel for them. Recognising also that it's not just about the care, it's about visiting those facilities. And so a lot of our thinking is about transport, not just emergency transport, but for those who want to visit the facilities. So, and the other thing I would say is that it's not just about the new hospital. We plan to maximise the assessment processes more locally, so that you don't have to travel to the new hospital for assessment, and also the rehabilitation locally, so you don't have to be stuck in the new hospital. You can get back closer into your communities as soon as possible. So thank you very much.
Thank you. Now the final two questions come from Jonathan Rose, SOSPAN, who's actually joined us today, which is great, and if that's okay, I'll carry on and read them out. And the first question, I was going to try and catch Phil before he sat down, or is Andrew doing this one? You doing this one? Fine. So I'll start with Joe. The first question is, with the cost of living crisis and the deprivation already a major issue in many areas of Llanelli, what is the Health Board doing to ensure the poorest can access health services free of charge? I'm going to invite Joe McCarthy to answer this.
Thanks. Yeah, thank you for this question. The cost of living crisis is hugely worrying and challenging. There are clear risks to health, both physical and mental health, due to additional stresses caused. Reduction of disposable income affects people's access to healthy food. We know there are issues around heating homes and travelling, just to name a few. As part of our strategy, we're looking to provide as much care as close to home as possible. And I know my colleague, the Director of Primary Care, has already mentioned that we are one of the only health boards looking at a GP and pharmacy, primarily GP and pharmacy delivered COVID vaccination model for this autumn, to try and minimise the amount of appointments that people need to have the vaccinations, so they can have the COVID and flu vaccinations together, and also minimise the stress then of travelling to mass vaccination centres as far as we can. We're also working with our healthy schools and preschools teams to try and identify and address issues around how the cost of living crisis is affecting our children. There are many stories coming out of that work that's ongoing at the moment, actually, and many issues that are being brought to our attention that we're addressing as fast as we can. And putting mitigation measures where those issues are highlighted to us, and also our Director of Workforce and her team are working to try and provide support to our staff where needed as well. We're also working on longer term solutions to try and ensure that the impact of the cost of living crisis on health and well-being of our population longer term is reduced as far as possible. But this is an extremely important area. I think there is much more that we are doing. There's a lot of pockets of work going on across Hywel Dda, and I'm aware this question came in quite late yesterday, so we'd welcome opportunity to provide you with more detailed written response, if that's okay. Thank you.
Thank you very much, Sarah. And our final question from the public for this afternoon is what progress has been made in the development of a midwifery-led maternity unit for Llanelli?
Thanks, Jonathan, for the question. I was just reflecting that the first time we met was actually as part of the strategy engagement, wasn't it? And I remember that's what so and Samuel. And it's funny how things trigger you, because I was just thinking as I sat there that the last time I was stood in that exact same spot we spoke about, it was because I was there and it was a field hospital and we had patients in it. So it just shows the bizarre 4-year period we've had since the strategy was approved. In terms of the question, the development of a midwifery-led unit in Llanelli was not part of the Mid and West Wales strategy that we approved in 2018. The suggested locations for that in the strategy were the repurposed Llangwili sites and the repurposed Withybush site. On the basis, and should we get approval for the programme business case and the new hospital, obviously we'll then embark on a conversation around the different pathways we'll need for service delivery, and in particular maternity services, and therefore we'll start getting into the discussion and engagement around with our clinical teams around the location of the midwifery-led units, and certainly at that point the discussion around whether Llanelli could play a role in that is certainly still part of that discussion.
Thank you very much. That brings me to the end of the questions that have been submitted from the public. So before I close, I just want to make sure that to ask if there are any questions from members of the board at all, to give you a chance as well. Can't see any, so that's okay. So I would like to thank everybody who has participated and listened to the AGM, and I hope that everybody enjoyed the films. I'd also like to thank my executive director colleagues who responded to those questions, and also for all the work on the annual plan and the annual financial report. And I'd especially like to thank the board secretary and her team for the work that's gone on to ensure that we could have our AGM partially in person, but also virtually. So thank you, everybody, and enjoy your evening. Thank you. Right, can I